Hello students, this is the second lecture video for Unit 4. We'll be reviewing the slides and I'll be giving you some tips and asking you to follow up after watching this video by going to the slides and clicking into the links and then answering the discussion question. And finally, remember that this week you also will have a Zoom conference schedule. All right, so let's talk about phytochemicals. Phytochemicals are plant substances that are not essential nutrients. You wouldn't die or develop a deficiency disease without them, and yet they do prevent an array of health problems. They're very good for us. This chapter talks about not only phytochemicals, but functional foods. Functional foods are foods that are especially healthy, and in some cases that is because of the phytochemicals. Here's a list of the phytochemicals, or at least a number of them. You don't have to memorize them for the test. What I'd ask you to do, however, is to look this chart over and maybe be encouraged to include more of these in your diet. For instance, let's take a look at curcumin. Curcumin is very popular right now because of all the great research. It's found in turmeric and mustard, and it is not only an anti-cancer, antioxidant, but also shows pretty powerful anti-inflammatory properties. There have been some good studies that have shown that curcumin is actually helpful for people with arthritis. My dog Lucy, by the way, took curcumin supplements to help with her arthritis. So here's a chart that I really love. I love things that make nutrition more simple and encourage change, and this does. Okay, when you look through this list, you'll find at least one or two things that you could easily do and that we've discussed already in this class in terms of preventing other non-communicable diseases. So something as simple as choosing more fruits and vegetables with different colors. Often the phytochemicals are pigments, so you'll see brightly colored fruits and vegetables tend to be phytochemical rich. Spicing up your food with things other than salt, herbs, and spices. Snacking on whole grain crackers is another idea, so read through this list. You can watch these video bites. Remember, they are helpful for helping you remember some of the major points. There's a little silly section in the middle, but other than that, they are very beneficial. So this is an important topic and something near and dear to my heart because what runs in my family is cancer. So I've made it a point to keep up to date for personal reasons on cancer research. I'd encourage you to visit all of the links. There's some great information here. This one in particular emphasizes that many people don't understand the strong lifestyle connection to cancer risk. It is from about 30 to 40% of cancers could be prevented with proper lifestyle, things like diet and exercise, not smoking, etc. So this is important to review. The American Institute of Cancer Research put forth these recommendations for reducing the risk of cancer. So again, there are things that you can do even if this runs in your family in order to decrease your risk. Links included, so visit them. This will take you to the AICR page. Keep in mind that we now know that extra body fat is not simply a heavier load for the heart and the rest of the body to carry, but it also influences a number of hormones and factors that influence health. So there are a number of cancers that are linked to weight, with an increasing weight, increasing risk. Breast cancer is one of them. Another are the cancers of the gastrointestinal tract as well. Being active is important. Women who are breast cancer survivors have a lower risk of recurrence when they're physically active. Remember to stress what we should put in. So all of those healthy plant foods and the ultra-processed foods should come out. Be sure to look through the rest of these And the next slide shows you relative risk a little more clearly because it can be overwhelming. People hear recommendations to reduce cancer around lifestyle and they say things like, they tell us everything is bad for us. They become frustrated. And if you look at this list, you can see which of these practices has the greatest impact. So clearly, smoking, keeping a healthy weight is very important. And look where drinking less alcohol is. That is important to recognize, that we now know that alcohol is a significant risk for cancer. Take a listen. Sorry, bacon. And on to water and the electrolytes. So we're moving into the minerals, and nutrition textbooks, when looking at the minerals, always start with water and the electrolytes. And that's because the electrolytes are minerals in their charged form in solution. So here we go. We know how important water is. In fact, it's the most essential of the nutrients in terms of how long you can go without it. Only about 5 to 7 days, and then you will die. It is life-threatening to go without water. Food and its nutrients, you can go for a much, much longer time. We know that blood plasma is 90% water, and our body weight is about 2/3 from water. And in fact, just as a little clinical pointer, that's important because one of the things we see is when patients, especially long-term care patients, have a rapid shift in weight from one day to the next, it's related to fluid, either edema if you see weight gain, or dehydration if you see weight loss. So you can read through the reason that fluid water is so important, and we find it in different spaces in the body. One of the things we talked about when we talked about proteins was the importance of albumin for keeping fluid within the blood vessels, and when we don't have enough protein to make albumin, the fluid slips out into the tissue spaces, causing edema. So as with all things nutrition, balance is important, and looking at this balance scale tells us a lot about how to keep that balance. One of the first major points here is that we consume water not only in what we drink, but also in the foods we eat. Depending upon your diet, you can get a significant amount of water in the foods you eat. Things like fruits and vegetables and other foods that are soaked in water before cooking and consumption. When you look at the water output side of things, you can get an idea of what conditions would require more intake in order to prevent dehydration. So any condition where there is an excessive loss of urine or polyuria, something like uncontrolled diabetes, for instance, can cause dehydration. Excessive sweating, being in an extremely hot environment, working hard at a sport in an extremely hot climate, and certainly diarrhea, excessive fluid loss, and feces. All of these things would require greater consumption of water to prevent dehydration. So we mentioned that water is found not only in fluids, you can see fluids are mostly water, but also in fruits and vegetables and things like beans. We can find rice as well, has a significant amount of water. So in order to prevent us from becoming dehydrated, we have a couple of safeguards: the brain and the kidneys. So one of the things that happens when you begin to become dehydrated, is that your blood volume drops and the solute concentration in that blood increases, and that will trigger thirst signals, which should trigger drinking. On the other end of the equation, what we see when there is the beginning of dehydration, decreased blood volume, increased solute concentration, is that the kidney conserves water. And because of that, one of the signs of dehydration is less urine, of a darker color, and a stronger odor. So that could be a significant indicator of dehydration. be sure to listen to this quick short video on the importance of water. It does a nice job of looking at this from a science viewpoint. Take a peek. Water needs do change as people grow and grow older. Take a listen. So the primary or principal electrolytes are sodium, potassium, and chloride. They are charged ions, very, very important for things like nerve conduction, blood pressure regulation, and muscle contraction. When people have deficiencies of these electrolytes, and there are a number of reasons that may happen, some of the effects are muscle weakness, cramping, and those are due to the problems with muscles and nerves. We may look at this at our Zoom meeting. I have to figure out a way to incorporate that, so I'll be working on that. All right, so in talking about sodium and potassium, there is a connection to cardiovascular disease and high blood pressure. So let's take a look, first of all, at the sources of these two minerals. What you should see from these charts is that in whole foods, lightly processed, less processed, you get more potassium and less sodium. And in highly processed foods, you have the opposite situation. More sodium, less potassium. The typical Western diet, the diet that many Americans, most Americans are consuming, is high in sodium and low in potassium. And this is the wrong ratio for cardiovascular health. We really need to almost flip these things. Our diet should be higher in potassium and lower in sodium. And yet, the foods that surround us look like this. Take a peek at the amount of sodium in a large Italian sub. Keeping in mind the dietary guidelines are less than 2,300 milligrams, and for people who have high blood pressure or are at risk of high blood pressure, most experts recommend less than 1,500 milligrams. So we see food contents like this and this, double, triple the amount that you should have an entire day from just one food. And this, it's really astounding. So how do you cut down on salt? There are a number of tips that are listed in this chart. I just want to make a couple of points here that you may see on the tests. First of all, in accordance with the chart we looked at a couple back, about 3/4 of the sodium we consume comes from food processing, the restaurant, the fast food, the packaging of that product, 3/4. So most salt is not found naturally in food, and in fact, we're not adding most of it. Though limiting salt at the table and not adding it to rice and pasta water is a good tip, most important is to read labels and check the amount of salt in those processed foods. One other mention has to do with flavoring. Flavoring without salt and salt compounds like seasoning salt, garlic salt is really important. And do keep in mind that kosher salt, high in sodium. Sea salt, just as high in sodium. So unless you're using less of these different salts, they're still quite high in sodium. There is a product on the market usually referred to as light salt, which is a combination of sodium chloride and potassium chloride. That is lower in sodium. And there's an 100% potassium chloride product as well. I don't see it often on the supermarket shelves, however. So take a peek at this, and now we'll have a brief discussion of high blood pressure. High blood pressure refers to an increase in the pressure of blood against the artery walls. There are many factors that increase the risk of high blood pressure, things like getting older. In this country, because we tend to eat a lot of sodium, as we get older, our blood vessels become much more rigid, less flexible. So this is a factor. What we eat, our alcohol consumption, stress, ethnicity, you can see there are a number of factors that apply. Now, as far as these new guidelines, these are relatively new. There is no more pre-hypertension. That was the biggest change. We used to have this gray area called pre-hypertension, and the expert committees believed that that was misleading to Americans because Americans would believe, I don't have to worry about my diet or my lifestyle because I'm not really hypertensive. I don't really have high blood pressure. So that was eliminated, and now we have these categories. For the test, know what normal means, and keep in mind that 120/80 is considered elevated. You need to be under that to be considered normal. So keep that in mind for sure. Also, at this elevated stage, what you need to understand is that that should be the place where you apply lifestyle changes and give that a try. Some people can control their blood pressure with diet and exercise. You would move on to medication in these more advanced stages. There was a big control study a few years back which found that a diet called the DASH diet, dietary approaches to stop hypertension, significantly dropped blood pressure. This was a huge breakthrough because until then we didn't think diet could mirror what medication did, and this study showed us otherwise. This isn't the best slide for showing us the DASH diet. I'd recommend doing a little bit of research. This diet's recommended as a generally healthy diet for everyone, a good diet for lowering blood pressure, and even a brain healthy diet, by the way. It's Mediterranean diet-like with a little bit of a difference. Very high in fruits and vegetables, moderate amounts of dairy as well, and less of the protein foods, but loads of fruit and vegetables, which isn't really apparent from this slide. The thing about the DASH diet is we know that it drops blood pressure more because of what we put in than what we take out. So it does lower the sodium intake, but it also increases because of these foods, the calcium, potassium, and magnesium intake, and we know that those minerals lower blood pressure. So it's a great diet to keep in mind. Pet peeve of mine is that I hear stories about patients who are newly diagnosed with blood pressure, and their doctors tell them, take this medication and eat a banana every day. Now, there's a reason for that advice. Medication does lower blood pressure, and bananas have potassium, which some blood pressure medications cause you to excrete. But there are problems with that as well. First of all, those doctors usually say, and cut out the salt, okay? So first of all, bananas aren't the only source of potassium. Lots of fruits and vegetables, things, that you see in this cart, for instance, milk as well, are quite high in potassium. So potassium is important, but bananas are not the only source. Remember that for a test question. Secondly, yes, we should reduce sodium, but these other points of action are really, really important. We need to look at this in a more holistic way. Watch your weight, increase physical activity, cut down on the alcohol, quit smoking, find a way to reduce stress. All of these things should become part of the conversation for keeping blood pressure in a normal range, for lowering high blood pressure. All right, so we're moving on to cover the major minerals. We'll focus on calcium and bone health. Major minerals refer to the amounts in the body and in the diet, and you see they are required and found in larger amounts than the trace minerals. Minerals as a category of nutrients are found in all of the food groups. Certainly variety is key to making sure you get what you need. And a new focus area here is this term bioavailability. Bioavailability. It's very important with respect to minerals. Bioavailability is not the amount that you consume, the amount on your plate and then into your mouth. It's the amount your body absorbs. And what's very interesting about a number of these minerals is that their bioavailability is very limited and in fact is impacted by other foods that are consumed at the same time. We'll look at that. What makes this more complex still is that the foods that contain substances which reduce bioavailability tend to be really healthy things, and we don't necessarily want people to cut them out of the diet. We'll talk about applying this information when we discuss iron in the next lecture video. Minerals act as cofactors. And let's focus in on calcium. So calcium accounts for a good bit of the body weight. It provides structure to bones and teeth. We need vitamin D to absorb it, and bioavailability is impacted by a number of substances. 99% in fact is in our bones and teeth, but here's the kicker. The remaining 1% is found in body fluids, and that 1% does such an important job, in fact several jobs, that our body needs to keep that in the normal range. Nerve transmission, muscle contraction, blood pressure regulation, release of hormones. So keep that in mind. We're going to come back to that point. Calcium is found in a number of different foods, but certainly milk products and fish with the bones, by the way, not fish in general, but fish that have tiny bones that we end up consuming. Those are the highest in calcium. Now, for vegan vegetarians who don't consume milk and don't consume fish with the bones, there are a number of other foods that provide calcium in smaller amounts. So variety is key, and sometimes fortified foods or supplements are necessary. So let's talk about supplements, because this is important. In the old days, doctors who worked with perimenopausal women around menopause and after menopause would advise big old doses of calcium. Take 1,000 milligrams every day so you don't develop osteoporosis. And that was the common practice for many years. What happened a couple of years back, maybe more than a few, was that some research started coming out that showed that women who took calcium supplements actually had a greater risk of heart disease. It seemed that calcium in these high doses increased calcification of the arteries, and that was scary. So now we've changed our practice and our recommendations to this, and this is what I recommend as well. We're going to talk about osteoporosis, and it's a horrible disease. You can take steps to prevent it early in life. The first thing you want to do is to achieve as close to your calcium goal as possible with diet. Food first. However, you may not be able to get to your goal. In that case, you fill in the gap and no more with a supplement. So let me give you an example. Let's say I need 1,200 milligrams of calcium. That is my RDA. And I try, but because I'm not a big milk drinker, I can't quite get up to that amount. I get to 1,000. What should I do? I should take about 200 milligrams of calcium a day, not, for goodness sakes, 1,000. The other recommendation is if you need more calcium than 200 or 250, take it in small doses. It's more physiologically normal for the body to get a smaller dose of calcium, and we believe the risk to calcification of blood vessels will be lower. All right, so back to this relationship between the bones and the blood. Let me explain this to you. If you had a patient who had a very low intake of calcium, and this was their typical diet for the past many years, and you sent away her blood to be analyzed, it would come back and it would have normal calcium levels. And you might think, well, how would that be possible? That is possible because when you don't get enough calcium in your diet, it's not taken from, you don't see the drop in your blood calcium, it's taken from the bone to keep the blood calcium normal. And that's what causes osteoporosis. Your bone is a bank for your blood. If you don't get enough in your diet, your bones, as you see here, will thin out. The lattice will thin. You'll lose mineral, you'll lose density, and you'll actually have very brittle bones with holes in them that break quite easily. By the way, be sure to watch that little link. Now, what becomes important in determining risk of osteoporosis is the amount of density that your bones achieve at peak. So peak is somewhere between 18 and 20, and maybe 35. Through those years, childhood, adolescence, young adulthood, you can continue to add density to your bone with things like a healthy diet and weight-bearing exercise. After that point, you're going to lose density. The more density you have at peak, the less of a risk that you'll have to dip into the osteoporosis range, the brittle bones range. So a couple of things you'll see and why men have a lower risk of osteoporosis. They tend to achieve a higher peak bone mass. And women, notice this, there is a slope, and then the slope changes around 50. It becomes much more rapid. Women also go through menopause, and after menopause, there is a rapid decline in bone mass. So these are the risk factors for osteoporosis. Certainly more women than men develop it, but men are not immune. Men of older ages do develop osteoporosis. This is more of a problem with people as they get older. Race does influence your risk, as does family history. Something that I typically mention to my students is if your relatives become shorter as they age, that means that you have a family history of osteoporosis, so take steps now to decrease your risk. People who are thin and light have a greater risk. Smoking and alcohol is hard on the bones. The right type of exercise is bone protective, and diet is important, and we'll talk about that. So what happens with osteoporosis is that these bones become brittle and crumble or break. The reason for the loss in height that you see in aging women and even men is due to the crumbling of the vertebrae and the kind of sloping over of the spine, which can also cause a dowager's hump as well. Unfortunately, we don't have an early risk or an early sign of osteoporosis. The only early indicators are if someone takes a fall, they fracture perhaps an ankle or a wrist, something that shouldn't fracture, and then doctors do a bone density test to determine if their bone density is low. This type of test is not done or covered by insurance unless you have the ability to show that you're at risk. This, by the way, not only causes loss of height, but a great deal of pain. So this can be a very painful disease. People with severe osteoporosis can cough and their ribs break. This is something that you want to prevent. So let's talk about that. Enough calcium. Food first, fill in the gap. The right type of exercise. Move your body mass through exercise or use weights or weight training equipment. Don't smoke, don't go overboard with alcohol. Make sure you get enough vitamin D, because if you have enough calcium but not enough vitamin D, you cannot absorb that calcium. And there are studies that show some impact from high amounts of animal protein and also sodium, increasing bone mineral loss. Do this now. This is not something that you want to develop as you grow older. So a quick look at a couple of other minerals. Phosphorus is also a bone health mineral. It's important that you get the right amounts in your diet because you'll see here deficiency can cause bone loss, but toxicity can also lead to some bone issues as well. Magnesium, I have a link here. Magnesium is a mineral that is in the news quite a bit recently. Deficiency is rather rare. Something I also want to mention to you. A lot of you, when you're doing your homework and carefully checking your UL for magnesium, will notice that it's set at 350, which is very close to the RDA for magnesium and doesn't seem to make sense. The UL for magnesium refers to only non-food sources like medications. So in this project, you shouldn't be recording medications or supplements, and therefore you will not be exceeding that 350 from non-food sources. Okay, you can more or less ignore the UL for magnesium. Sulfur, found in protein foods and some additives. And there we go. So remember, look through your slides, go to the links, answer the discussion board topic, and then make sure you know what day we're meeting for our Zoom class. Take care, stay safe, have a good rest of the day.